Most people's ACL recovery is messed up before it ever really begins. They assume that the early stage after surgery is the easy part, and they think that they can just go to any general physical therapy clinic and look for more specialized help after. While this might sound logical in theory, it actually sets a lot of people back. One of my clients came to me at 8 months after ACL surgery. He was frustrated, confused, and starting to think, would he ever get back to playing basketball? He had been going to a local physical therapy clinic, doing the basics, but things never actually felt right. His knee was still stiff, he was missing motion, and he still had pain at 8 months. And he kept hearing, this is normal, just give it time. But deep down, he knew he was behind. And the truth is, what happens in the first few months after surgery can make or break your recovery. And this isn't just a one-off thing. I see this all the time. People are told the early stage is the easy part, so they don't get the guidance that they truly need. And by the time they actually realize it, they're already playing catch-up. In this video, I'm going to show you how to crush the first phase of your ACL recovery so you're not playing catch-up later. And I'm going to break down the exact milestones needed to set up a successful recovery and answer those important questions like, when can I safely get rid of crutches? And how much range of motion should I have? And more. Let's dive in. Restoring what we call a quiet knee is the overarching goal of early ACL recovery. So what does this mean? Well, there are actually 4 main components to a quiet knee: swelling, quadriceps muscle activation and control, range of motion, and pain levels. I'm going to break down each one so you know exactly what to do. A quiet knee is a happy knee. It means swelling levels are improving. It means there's a quality quadriceps muscle activation, aka you can flex your quad on command and it activates appropriately during simple tasks. And your range of motion is progressing appropriately. Nailing down these 4 criteria are critical. Missing key milestones early on is like trying to build a mansion on quicksand. It doesn't matter how hard you work to build that house, it won't hold up on a poor foundation. Let's talk about knee swelling first. Swelling is a double-edged sword. On one side, it's completely normal and actually necessary for healing to occur. But on the other side, it can wreak havoc on progress if it's lingering longer than it should. So, will your knee be swollen for the first 1 to 2 months after surgery? Of course, but it needs to be decreasing over that time period. How do we know if it's improving? It must be measured frequently. I would recommend it being measured 3 to 4 times per week, ideally once in the morning or before an activity, and once immediately after activity or at the end of the day. This is how we can tell how well your knee is tolerating the activities that you are doing in that time period. Your knee can't talk, but swelling, pain, and knee joint soreness is how your knee communicates with you. So if swelling is increasing after an activity, after exercising, or after physical therapy, or it increased more than your normal baseline the day after exercising or introducing a new activity, right? This is your knee's way of saying, hey, I'm not too happy with what we're doing. Common mistakes I see all the time is 1, not measuring and monitor swelling often, and 2, hearing, it'll just take time. It will take time, but time means nothing if swelling isn't being assessed and addressed. If swelling is getting worse or hanging around longer than it should, you will have a very difficult time getting back your knee range of motion and improving your quadriceps strength. Icing and elevating can help swelling temporarily, but the big players in the room when talking about swelling management are going to be monitoring it to make sure that your rehab plan is actually agreeing with your knee, avoiding excessive time spent on your feet within the first month or so, and making sure you are hitting the rest of your milestones that I'm going to cover next. Next up is pain. Pain is your body's alarm system. It's your knee's way of saying it isn't comfortable or used to what you're doing. Like swelling, pain is a normal part of the recovery process, but again, it needs to be measured to be appropriately managed. Pushing through the pain is honestly the reason why so many clients that I start working with who are 3 or more months out from surgery, who feel stuck, and their knee is still irritated. But pain can be a little deceiving. Just because you feel pain doesn't necessarily mean that anything is being damaged or harmed. Remember, it's an alarm system. So the question becomes, how much is too much? And it honestly depends. We need to first get an appropriate baseline measurement and then make educated decisions from there. Once pain levels are under control, I recommend no more than a 4 out of 10 pain during exercise that ideally returns back to that established baseline afterwards. As with swelling, pain should also be monitored within a 24-hour period of exercising. So if you felt good while exercising, but you feel more pain than usual the next day, or you feel more joint stiffness or joint soreness, not muscle soreness, this could be your knee telling you that it wasn't adequately prepared and what you did might have been a little bit too much too soon. Just like swelling, consistently pushing through high levels of pain will set you back and slam the brakes on quadriceps muscle strength and range of motion gains. Next up is quadriceps muscle activation. Now, there are many important muscle groups that are negatively affected after ACL surgery, but the quadriceps muscles take the biggest hit by far. Regaining sufficient quadriceps muscle strength is arguably the top metric to restore to reduce re-injury risk, improve long-term joint health, and improve quality of life. And that work starts now. The early stages are critical. Neuromuscular electric stimulation is a research-supported way to really get those quads firing, and I have all my patients use it if it's safe to do so. This isn't the feel nice stim. This stim, when performed correctly, is uncomfortable but tolerable and makes your quad muscle contract hard. As far as early exercises to improve quad strength, things like quad sets, TKEs, knee extension isometrics, leg press, and squatting variations are early stage staples. The specific exercises, the sets, the reps, the weights, all vary on a case-by-case basis. It's all about finding the right balance of working the quads while respecting the healing process. So work with an ACL specialist and they will be able to find the right plan specific for you. Here's a hint, not the same cookie cutter plan that they give to everybody else, including grandma next to you. But remember, no amount of quad work means much if pain and swelling levels are elevated and being ignored. Next up is full knee range of motion. This is probably the most missed milestone I see in the early stages, and it can really mess up someone's recovery. The further out from surgery you go, the harder it is to regain range of motion. With the knee, we have two main movements: extension or straightening motion, and bending or flexion motion. Both are important. However, knee extension is more important to regain early in the process. Full extension motion that is 100% symmetrical to your non-surgical knee is the glue that pulls everything together. Without it, walking won't be normal, your quad muscle won't work as well, and your knee will likely become irritated as you try to progress in your recovery. Failing to achieve full symmetrical extension can also sometimes lead to abnormal scar tissue formation and possible development of what we call a cyclops lesion, often requiring a second surgical procedure to fix. Not good. Timelines are important. Ideally, you want to achieve full symmetrical knee extension motion within the first 4 to 5 weeks after surgery. So this needs to be a top priority. One of the biggest mistakes that I see with my clients when we first start working together online is that they were told that they had full knee extension motion, but they actually don't. And it's actually one of the top reasons why they were struggling. Getting your knee to 0 degrees or flat isn't enough if your non-surgical knee hyperextends. Symmetry is non-negotiable. Knee flexion motion is also important to gradually restore during those early stages. And again, like extension, the end goal needs to be symmetry to your other knee. If you had other surgical procedures along with your ACL reconstruction, for example, like a meniscus repair, there might be restrictions on how much flexion motion you can safely work into for the first month or so. But for an isolated ACL surgery, we typically want to see full flexion motion between month 2 and month 3. Range of motion can be a grind to get back. So if you're feeling stuck or want to learn my research-based process for achieving full knee motion, check out this video here. Last but not least, one of the most common mistakes in early ACL recovery is ditching crutches before your knee is actually ready for it. Listen, I get it. Crutches can be a hassle, right? And you might feel like you can walk around without them. But here's the big problem. If your knee technically isn't physically ready to get off of them, you're creating a monster that becomes very difficult to defeat the further out from surgery you go. This can lead to knee extension motion issues, persistent swelling, quad weakness, and poor walking mechanics. And if your walking is off, guess what happens when you try to run? Getting off crutches doesn't happen because it's been some arbitrary time since surgery, like 3 or 4 weeks. It doesn't happen because your surgeon or your physical therapist blindly tells you to get rid of them. It happens when you meet these specific criteria. You have full symmetrical knee extension range of motion. You have quality quad muscle activation and control. You can perform 20 unbroken straight leg raises without an extensor lag. And you can demonstrate normal walking mechanics without crutches. Until you meet these criteria, it's best advised to keep using at least one crutch. Getting off them too quickly can make it seem like you're progressing fast, but it can actually do more harm than good. So now you have the tools to start your recovery off right and set a rock solid foundation for everything else to come down the road. Remember, how you start will affect how you finish. If you found this valuable, please like, comment, and subscribe. If you're getting ready for your surgery, or maybe you just had your surgery not too long ago, and you want to work with a specialist to do this correctly the first time, honestly, kudos to you. If you're watching this and you're currently a few months down the line, or maybe even a year or two down the line thinking, oh no, I'm still missing some of these milestones, this is your warning sign. Seek out specialized help. Many of my clients often come to me months or years after surgery when they feel stuck and frustrated. So there is hope. You just need an individualized plan to attack it. In either case, I'm here to help. Click the link below to book your free call so I can learn more about your situation and see if I can help you get back to the active lifestyle that you love. See you on the next video.